Haven't heard from anyone about anything.
I'm
thinking I may make a phone call.
Yeah, I met with the chairman, Dick Kunert, and I did, because Paula Rena had some questions, about our budget. So we met with them, and I did express the immediate need for a new board member. And
yeah, because things are going to get voted on here in the not too distant
well,
future.
that's right. And plus proposals, reading,
right,
all of the above. So he said at the end that he was, planning on it. However, we'll just have to wait and see. I hope he does it quickly.
Yeah.
But yeah, I think that's good to put a call in.
Yeah.
See where things stand.
Where is everybody? Well, Jay is here. Hi, Jay.
Hey, how's it going there, Wendy?
It's going.
I'm kind of asking to be in, you can't see my face, but I'm trying to get in on my phone as well. We'll see if that'll work.
We can hear you well, though.
Yeah.
Well, you see, well, here comes Danielle and Linda.
Great. Hi, Danielle.
All right.
There we go. Now.
Oh, Danielle, I need to talk to you about something related to your job, but not the mental health board.
Okay. You want to, well, I have a meeting after this, but you want me to call you after that?
Yeah, when you have a free minute, give me a call. One of the judges is trying to, navigate. And I thought, who's going to know a lot about the ins and outs is Danielle. So
I'll try.
Okay.
Someone had contacted me about just a half hour ago about public speaking, but I don't see him in here yet. It'd be Harlan Johnson.
Pardon me, say this again. I'm sorry.
There's Harlan Johnson had contacted me about a half hour ago about public speaking, and or he wanted to attend the meeting. He said that he would be on the Zoom call to ask his question.
Well, actually, he would have to that has to be announced through the chairman's office 48 hours in advance.
It's actually through the info. We have our own email address for that, Marianne. It's the info at.
That's right. I'm sorry. You're right.
On the website, and we actually indicate that it can be, I think, anywhere up to 2 or 3 hours in advance of the meeting, which is consistent with the county board. But no one has signed up for that for today.
Okay, I will. I was hoping he would drop on here at least to listen, so he would know how to.
But okay, Jason, explain that, how the Zoom, he can attend in person if he so chooses. And
there's a YouTube link, Jay, so he can watch live. The YouTube link is available to the general public, so everyone can watch that live.
I see. That's what he's doing then. All right. Well, we may even cover it because his question was about the trauma-informed community and making sure that everybody who's delivering services is involved in that there's one list that everybody can see, and that they're doing a lot of things with trauma-informed community. And he was just very interested in making sure that we're helping that along.
Okay. One other suggestion, he would not have to wait for this public meeting. He could always contact Jason ahead of time and let him know, that if he has concerns or questions, and get some information that way too. And we welcome the public, for all the meetings. So
sure,
through YouTube. So that's great.
All right. I'm sure I can get that to him. He's probably listening to it now.
Okay. Well, I'm going to call the meeting to order. The Winnebago County Mental Health Board, November 3rd, 2021 to order. At this time, I will do the roll call. Starting with Dick Kunert. I don't see him. Reverend Copeland.
Present.
Hi there, Ed.
Hey.
Danielle Angeliri.
Present.
Dr. Bill Gorski.
Here.
Hi, Bill.
Hi, Mary Ann.
Dr. Terry Giardini.
Here.
Tim Neighbors. And Linda Sanquist.
Here.
And Mariana Body, present. Also, our directors, Wendy Larson Bennett and Jay Ware.
Present.
And granted, and also greetings to Jason Holcomb. And next, public comment, we didn't receive any requests, and we kind of just covered that in terms of, you know, if anyone has a question or would like to comment on an issue, we welcome it. But that has to be, I think, 2 hours before the meeting. Is that correct, Jason? I want to be clear on that myself. I thought it was 48 hours, but it's 2 hours. Is Jason there?
Sorry, Marianne, I'm pulling that up right now to give you the exact
Okay,
what it says on the website, and that was taken to be consistent with the county board.
correct.
If you want to move forward, I'll let you know. Nobody's
Oh, okay, that's very good. Presentations, do we have a request for any presentations? Jason, that you are aware of?
Oh, I'm sorry. No, there are no presentations. We will, again, iterate that opportunity to all of the funded organizations at the Learning Network meeting that's coming up, I believe, in this coming week. And so we will let them know again about the opportunity to come and present and encourage that some of the organizations sign up for that.
Okay, probably reminders is what's needed at this point, but I agree with you. Moving on to the monthly activity report, we all received that in our packet, our board packet, but Jason, do you have any particular comments on that report?
Sure, I'll just highlight a couple of things, and just to clarify, it is 2 hours in advance of the meeting to sign up for public comment. So we did receive the first quarter of outcomes, and that will be a discussion item at the end. We'll go over that a little bit. But we did receive all of those, and we summarized those into kind of some global trends, but then also highlighting each organization's early successes or challenges. We also had the first payments go out to funded agencies, the actual checks that were received by agencies after processing all of their payment criteria and coordinating with the county to ensure that that's going to meet their auditing requirements as well. So we're very proud that we got through that, and it's a huge milestone. Lastly, another discussion item today is the update to the 3-year strategic plan and the notice of funding opportunity, which are action items on today's agenda. Put a lot of time into those items this past month.
Okay, and before moving into the action items, Dick Kunert is present here. We took the roll call and Dick came in, so we all can see you, Dick, and verify your presence. All right, I'm going to need a motion for the October meeting minutes. So is anyone willing to put forward a motion for approval?
Tim Neighbors.
Tim, good. Okay, thank you, Tim. And do we have a second?
Second.
Okay, thank you, Ed.
Mary Ann,
Yeah.
one minor correction. I noticed at the very beginning, I was noted as present, and I apologize, I couldn't attend last month. Further down in the agenda where you did the roll call, I was noted as absent, but in the initial line of attendees, I was noted as present, so that would should be corrected.
It should be corrected. Thank you very much.
Mhm.
I read through them and didn't pick up on that, but that was about you. So thank you, Bill. That's helpful. So we have a motion to accept, and now we'll have with the one edit brought forward by Dr. Gorski. So any discussion, any further discussion or corrections? Hearing none, I'll take the roll call. Dick Cooner,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist,
Aye.
Mariana Body. Okay, thank you. We've approved the minutes with the edit. Moving on to the second action item, a 3-year strategic plan update. And Jason, I'm gonna let you speak about that.
Sure. So there's really only three changes really. One is the actual formatting. So you see it's been reformatted, and in my opinion, it looks very beautiful. I think it's a very nice looking document. I would like to just acknowledge not only Chelsea's work on this, which she spent a lot of time on it, but also we had a volunteer in the community, Diane Zamudo, who volunteered her time to do the InDesign for this and to design the document. So she's very skilled in that, and she was able to help with that to get this in a very nice looking format that we can use moving forward for future updates. Secondly, there was in the target populations, we made a little bit more clarification about what that was. We found there was some confusion from some of the funded organizations as we they started operating their programs, and particularly for those that we had required to develop a screening process or to articulate their screening process. And so we clarified two parts of that. Number one is the inclusion of trauma as part of serious mental illness and serious emotional disturbances with some kind of specific research-based criteria for how that is identified and how that looks. And the second part of that, so let me just clarify, trauma is already as PTSD traditionally included in serious mental illness as a category, but you know, sometimes there's some difficulties wherein somebody may have really significant trauma in their life, but it doesn't meet the criteria for PTSD because it wasn't life-threatening in the moment. So they have all the same symptoms and they have all the same functional impairments, but because it wasn't a life-threatening event, it doesn't meet PTSD. And so there was some confusion about how trauma was being addressed. And so we did clarify that and clarified in general that the Mental Health Board's bylaws and from day one, what has always been articulated is that it's not just about the diagnosis, it's about the functional impairment. And that's really critical that we're talking about how symptoms impact somebody's ability to function socially or occupationally. And so we just added some clarification. It's not changing the categories, it's just further describing that to try to address some of the confusion that some of the organizations had this year and to make it very clear going into our next round of funding.
Thank you for that.
And lastly was the addition of clarifying types of practices. So when we say evidence-based versus best practice or promising practice, we actually added some definition to that based on how those things have been identified in research, and indicated that really, you know, the priority will go to evidence-based practice and best practice, but that promising practices and emerging practices would still be encouraged, because often when something meets the criteria for evidence-based, it may have an implicit bias in that where it has been generalized and may not be applicable to every population. So promising practices are encouraged, but in the funding decisions, they probably would not be funded at the same amount that an evidence-based practice is, because there's they need to demonstrate their ability to perform results and then stabilize over time.
And Jason, a question about that with the change or more specific definition for promising practice. We're still talking about with the targeted population.
Absolutely.
Okay. All right, so I will need a motion to approve the 3-year strategic plan update.
So moved.
Second,
Second.
thank you. Dr. Gorski moved and Dr. Giardini seconded. Is there any further discussion, questions? Hearing none. Oh,
Mary Ann, I
yeah.
would really, first of all, like to, congratulate Jason and the staff for clarifying those. Number one. Number two, I don't know about the other board members, but I've heard, some people will say to me, well, it doesn't look like the board is doing anything new or different. You're just simply, pouring money into the same old places. And one of the responses that I'm making with that is exactly what we just passed, and that is, wait a minute, the grants that we have put out, and the grant agreement that we have with the agencies explicitly calls for them to do best practice and to meet the highest standards of what is being done in the field at that time. So just because we for example fund treatment, just think that it's the same old thing and you should throw that out. That seems to me to be just bizarre. But rather, what we're really talking about is the way that we expect it to be done, and the expertise that we want put into it. And so based again on research, the outcomes should be positive. In other words, people should get better and there should be more healing.
Dr. Gorski.
I just want to reinforce, Dick kind of took some of the words out of my mouth. First of all, just to congratulate Jason and his team. This is a marvelous document, well put together, rich with information, and I just think it's extremely well done. And he and I had a chance a week or so ago to talk a little bit about the outcomes, and even in the first quarter. I think to Dick's point, the same old arguments may fade once true outcomes begin to be demonstrated in the community that affect individuals and populations in ways that we can show. And, you can say, well, you're funding the same old thing with maybe the similar existing agencies, but once the dollars are driving substantive outcomes with people and populations, I think that will be really powerful. And I know early on, a lot of the outcomes are process and logistic outcomes, but as time goes on and as the projects mature, they'll become much more individual and population oriented, which I think will be very powerful.
And I would just like to add that the other huge dimension, as I see it, is the access got opened up to people that by history have fallen through the cracks. The uninsured, no Medicaid, no private insurance. I can vouch for the fact that this population has been underserved in our community forever. When in fact you have a job and you have a very serious mental illness and you're going through a recent episode, you can't go to work. And many times those individuals, if they're part-time or, let's leave it at that, they have no benefits. Therefore, they really just don't have access. They have no way to pay for it. So I think what we have done is opened up a brand new demographic on its own, meaning the unfunded person, period. So, and I think that really we need to somehow talk about that in the community too, because those are the people that we've never been able to really serve consistently, and these funds allow for that. So,
And And Marianne, I have to say, I had a nice meeting with Jason and Judge Gibbons and Nick Zimmerman, the public defender, about some of the gaps in service. And what's apparent is the crisis response team is
Right.
showing up in court. They are advocating for people. They are finding housing. I had a crisis response team show up in court the other day, and the defendant, who had been in court in error every day of the week,
Yes.
except the day that the crisis response team was there, they were all upset, not because he didn't show up, but because they had arranged to get him furniture for the apartment they'd set him up in a sheltered living arrangement. And they were frustrated that they didn't have a good contact, but it's like, no, the system is working because you're here and you're providing resources, and you have somebody who's out in the community who probably just needs a boost instead of a stint in jail. So
Right.
It was awesome. It was really awesome. So
Wow.
our money is working, and you're right. Somehow we have to do PR soon, but that's a different issue. So that's all.
I think the other thing that I found somewhat troubling as it relates to your point about access, Marianne, and I guess I always felt I intuitively knew that, but I wasn't really aware of the startling mismatch of providers to population ratio that our area has relative to the nation. And that's a big problem because it's hard to have access without providers. And I just throw it out there because maybe some of the others of you were taken as much by that as I was, but that seems to be a key point, and it's seems problematic to figure out how to address that in a more systemic way.
Well, I agree with you. And we do need to have more discussion about that. I don't know, looking at the agenda today, if that is one of the items, but I do think that Jason has been outreaching to connect with the local labor resources to see what we can generate, even from the influence of the mental health board to help recruit more providers. So, we've been active in that arena. Jason, did you want to speak to that a little bit? Because that's important too.
Yeah, we had a meeting with the Workforce Connection. We understand, and we, of course, will talk more about it and the outcomes, because really that's the number one challenge that all of our organizations are facing right now is hiring. I've been in multiple meetings. Also, there was a state Senate hearing, I believe, a week and a half ago, in which that was the entire discussion, was the behavioral health workforce shortage. One of the state senators asked for a very large sum of money to be put into the state budget to address that issue. One of the strategies that's being addressed at a state level is trying to increase the number of peer training programs for peer recovery specialists, who are folks with lived expertise, and to provide them opportunities to get trained so that they can join the workforce as behavioral health specialists that don't need to have a bachelor's degree or master's degree. So that's one of the short-term strategies they're working on, but we've got that conversation happening with our network, ACMI, that we're part of. It's happening at a state level. ACMI is advocating for things. It's happening at a local level with Workforce Connection, or conversation that we started with them, and they'll actually be presenting to our funded organizations at the next Learning Network Collaborative to start talking about local strategies that we can take to reinforce the workforce here for mental health and substance use.
Thank you for that. So we have a motion and a second to approve the 3-year strategic plan update. At this time, I'll take roll call. Dick Cooner.
Aye.
Dr. Copeland.
Aye.
Danielle Angelari.
Aye.
Dr. Gorski.
Aye.
Dr. Giardini.
Aye.
Tim Neighbors.
Aye.
Linda Sandquist.
Aye.
Mariana Body. Aye. Moving on to our third action item, notice of funding opportunity for the program year 22 and 23. Jason, do you have comment on this?
Sure, yeah, and as I thanked Chelsea on the last one, and thank Kristen, she put a lot of time into updating both the notice of funding opportunity and the scoring rubric, and is working now on the grant application. But this notice of funding opportunity has been updated from last year's to reflect the expansion of funding of up to $15 million, to reflect the expansion of priorities to now include client identification and outreach and housing as defined in the Community Support System Framework primer. And those are, I think, the major changes on here. There's also then an updated timeline of events. So this year we're looking at adding something we didn't have last year, which is a pre-grant seekers meeting to just bring together organizations to talk about collaboration, to encourage collaboration, to just have a forum of saying who might be interested in working on an application, but maybe you don't have the capacity to be the lead, but you work with an underserved population, and you could connect with a traditional mental health provider to better connect them with this part of the community. So we're not going to get into program development conversations on that meeting. We're simply going to create a forum for interested organizations to express their interest in collaborating, and then memorialize that in a list that can be published on the website, and just let them at that point coordinate on their own. But we didn't want to take that active role in encouraging additional collaboration. Then there will be a December 1st grant seekers meeting, followed up by 2 question and answer sessions. We did that last year, it worked wonderfully. We're going to repeat that this year. And then we are leaving more time for the application this year. So 2 full months. We are 6 weeks ahead of where we were last year for releasing the application. We released it mid-January last time. We're releasing it December 1st this time, which gives us the ability to offer more time to write. And you'll all be happy to know it'll give you as reviewers more time to review. So that board actual funding decisions will target that April board meeting. Last time we didn't do it until May, made the funding agreement part a little more rapid. So this time we're feeling confident we can get all those funding agreements signed before that start date of June 1st and have everybody ready to rock and roll June 1st for new programs, and for those that are renewals to just continue their services moving into the next program year, and continuing to require those quarterly reports for outcomes.
Well, thank you, Jason, and thank your team for all the work. This is just tremendous. So appreciated. I need a motion for approving the funding opportunities for the years 22, 23. Tim moved it. I need a second.
I'll second.
Danielle. Oh, Danielle, you seconded, or you? So good. So we have a first and second. Is there any discussion, questions?
Yeah.
Can I say something? Oh, wait, Tim, you were first. Go ahead. I'm sorry.
I just really want to thank Jason for putting together the grant seekers meeting, because this is something that I find that the community needs, especially some of the smaller organizations or some of the organizations that are just starting but want to have access to the mental health money. And some of the people that I've spoken with, I told them to get with a larger program to see if they could add their program to their program. That way there's a better guarantee or a better chance that they're able to access money, but because if they try to go at it alone, they probably won't get the money. And so I encourage, everybody on the board, when you see those type of people, to, invite them to this grant seekers meeting. That way they can collaborate with the bigger programs. And even when they collaborate with the bigger programs, they may be able to come up with a better idea at the same time to help, what everybody's looking for. So I just want to thank Jason for that opportunity, and that's it right now.
Thank you, Tim. And I think, Carrie, you had something you wanted.
I know what Tim said, absolutely, Jason, but how much extra time are we going to get with these readings of these grants?
Well, Terry, I think what we're trying to encourage is actually not only to hit Tim's point, but to address that concern. We don't want necessarily 100 small applications. I think we'd rather see collaborative organizations, right, where organizations are working together to do something big. So I think that this is really meant to address both of those concerns. How do we connect with smaller organizations, make sure they have a fair chance to be part of it, and connect them with some of the bigger orgs, and also then try to encourage, work together so we're not getting so many applications, but those applications are coming together, the collaboration is built into the application. So I hope it does address that concern, actually.
Okay, I'm good.
Yeah. Okay. Well, thank you. So we have a.
Hang on.
Jay, you have something to say?
Yeah, I just wanted to ask about this collaborative meeting and how are we putting that out there? It's on the website now. Is that what it is, Jason?
So pending approval of this notice of funding opportunity, we will do a couple of things. We'll do a Facebook post. We'll push it on social media. We'll do our email update list that we have to hit all the organizations that way. We'll probably go back to that list of orgs that we did the environmental scan with and push it to them. We will also do a press release, and so we can probably get a couple of news media interviews that way and push it. And I really just encourage, if you're on social media, we'll share it with all the board members as well in an email so you can forward it. And then on Facebook, or Instagram, whatever your preference is or where you're connected, if you want to share it that way, to just really expand the number of folks that see that, and so that nobody feels they were left out.
Okay, that's good. That's what I was hoping for, is something to help amplify it,
I agree.
Okay.
Dr. Gorski.
Marianne, I was just thinking, it's really a question out of my own, maybe ignorance of our process, but I love the discussion of proactively educating people about collaborative avenues and opportunities they can take, but can we reactively encourage that? In other words, and maybe we have, I just don't remember or understand, if we receive a couple of grant applications, once they've been received, if we internally recognize, hey, these two organizations would have done better if they partnered up with each other, can we then encourage that, or is that, once that's happened, something we can't do?
I think,
Good question.
I mean, before you're talking about before Jason puts a notice out about the meeting, are you talking about right now?
No, I'm saying, let's say we receive grants and we receive 50 of them, but in review of them, they've already come in. That's why I'm struggling with, maybe that's not appropriate, but they've already come in, but we recognize, hey, there's a great opportunity here with a couple of these organizations to do this something together. Are we able to react in that way or not?
Dr. Gorski, if I could comment on that. So the last two sentences of the notice of funding opportunity state that the mental health board reserves the right to not select a provider or to submit a new notice of funding for redefined services. I don't think that's what you're saying, but that is one thing. And then the second sentence is the mental health board also reserves the right to enter negotiations with selected providers for all or part of the proposal components based on the selection criteria. So I think within that, there would be the opportunity for suggesting a collaborative effort. Then there's another layer to that in which the funding agreements themselves dictate that we can require collaboration among funded participants. So it might be two different funded programs, but we say there needs to be a warm handoff between the two of you.
Okay.
Something like that.
Great. Thank you, Jason. That helps. Thank you.
Okay, we have a motion and a second to approve the notice of funding opportunity. Did we already do that one? No. We have. I didn't take roll call for that yet. I didn't. Okay. It seems like I'm repeating over and over, but and I am. Okay, so the roll call. Dick Kunert.
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Good. I mean, aye.
Tim Neighbors,
Aye.
Linda Sandquist,
Aye.
Mariana Body, aye. Okay, moving to number 4 of the action item, scoring the rubric for reviewing the grant applications for programs for 22-23. And Jason, do you want to just summarize for the board?
I do, because there is a change here, and I think it stays consistent with the conversation that's happening. And so the rubric had 5 criteria before, and it remains with that. But the one that was changed was we had evaluation in there before, evaluation criteria. And what we found in working with organizations early on is that because of our process was dictating that we're not doing supplanting, we're doing new programming, organizations didn't really have an evaluation process in place. So we're asking them to articulate something they really didn't have their minds wrapped around. So we still have, what are the things that you want to accomplish? What are the outcomes as part of that program description? And we've now, as part of when we're evaluating program renewals, we want to evaluate how did you actually do on your data collection in that first year of your program. But what we found also, I think that was missing last year that we need articulated this time was, how does your program actually fit within a coordinated system of care? How will it collaborate with other programs? How will it connect with other providers? How will it fill gaps and address community needs in a collaborative way? So that just continues, I think, to, I guess, follow up on the conversation that's already been discussed about the importance of encouraging that and actually making that part of the evaluation criteria this time around. So that's added in here now as something we want to give the organizations an opportunity to articulate. When we reviewed last time, we got through all the reviews and kind of looking at each program independently and then said, okay, but now how are they all going to fit together? And I don't know that we really required the organizations to articulate that. And so this time we want to give them the opportunity to do that and score them on that.
And Jason, is there a way for us to maybe insert into this the value that the mental health board places on collaboration? Because to address Dr. Gorski's point of, there's this crisis in provider, absence, right? We don't have the bodies to provide the services, but we could make up for that by having this web of services where, stepping stones can't do that, but we know that remedies can. And remedies can't do it, but we know that Rosecrans can, so that we're doing more to enhance that connectivity so that the gaps are minimized and we're not being territorial.
So this is exactly the way to weight it, by including it in the scoring criteria.
Mm-hmm.
Then it's not an extra gold star at the end, that, you're just getting a pat on the back for it. It's part of the scoring criteria.
I agree. That's really important. Anybody else have a comment? Okay, hearing none. We will, now I'm even forgetting if I did the motion. I didn't. I need a motion to approve the new scoring rubric for
So moved.
Dick Kunert. Okay, I need a second.
Second.
No, it's got to be a board member.
Second.
Terry was.
Terry.
Who? Dr.
It
Cole?
Was Terry.
It's Terry.
It was Terry? I thought
Yeah.
it was Jay, I'm sorry.
I'll change my voice next time. For you,
Okay.
Marianne.
Because
So
I
when I'm
didn't
not
keep-
looking, Terry and Jay sound the same.
Yeah. Me and
See,
Jay, we go
that-
back a long
No,
way.
I'm not the only one. Good. I'm sorry about that. Okay, so any further discussion about this? Hearing none, roll call. Dick Cooner,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
In my own voice, I.
sorry, Tim Neighbors,
That's all right.
and Linda Sandquist.
Aye.
Mariana Body, aye. Okay, moving on to the program year 21-22 funded program special conditions met. And Jason,
Okay,
you
we're
wanna-
recommending 2 additional special conditions be considered as met. The first one is for ramp, for their special condition that they needed to fulfill a screening, to have a screening tool to ensure adherence to the target population. They did provide us not only a tool, but a very nice summary of how they do their screenings and what that process looks like. And again, how, and again, it is going to just keep repeating the same thing, but the emphasis not only just on diagnosis, but on functional impairment. So they did document that well, so we're making that recommendation. And secondly, for Remedies Renewing Lives in their domestic violence program, the same thing. I would really encourage you actually to read that document if you have it. It's quite detailed. It is really beautifully articulates the challenge of working with survivors of domestic violence in addressing mental health issues, because the way that a mental health diagnosis can sometimes be used against them in court proceedings, which is really sad, but that's a reality that we face. And so I think they did a really wonderful job of describing how they address that, how they work with that. We had multiple conversations with them about this. They were very thoughtful in their approach to ensure they were protecting the survivors they worked with, but also met the criteria that we had. And so I just applaud them for really how much time and effort they put into this, and encourage everyone to read it because it's really educational.
Thank
Which
you.
document was that?
I agree. Pardon me, Jay,
Which document was that?
was the ramp? The-
Okay.
It's the Remedies
Remedies, yeah.
document that's part of the meeting packet under the F5 program year funded program special conditions met, and then there's a
Page 27.
there you go.
Thank you. Okay, I will need a motion for approval for the funded program special conditions met.
So move.
Thank you. I need a second.
Second.
Okay, thank you. Here, any further discussion or comments? Hearing none. I will take roll call. Dick Cooner,
Aye. Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist. Aye. Mariana Body. Aye. Okay, moving down to the program year 21-22 amendments, budget amendments. I will ask Jason again.
So 2 funded program budget amendments, and I apologize if this seems laborious, but we want to make sure that these types of decisions really do go through the board when there's modifications to a program that you approved. So the first is in Remedies Renewing Lives. It's, when they originally filled out their budget, they include, there's actually match dollar program. They're getting some money from the state for this, and the mental health board is covering 25% of the program for this mental health therapist position they have. And when they originally filled out their budget, they included all of that in the revenue, but when they did their expenses, they only put the mental health board part in there. So we met with them just to discuss that, and they did update their budget to reflect all of the expenses. so that the, revenue and expenses are consistent with one another. So very simple adjustment, but just wanted to formalize that with the vote today, that change. And then the Rockford sexual assault counseling budget, they just found that they were going to be able to spend a little bit less on personnel this year and had a little bit more need in the travel and equipment area. And so they, I think, we allow as part of board policy for a change of $3,000 between categories without board approval. This was a $4,000 change from personnel to equipment and travel, and so it does require a board vote.
Okay, I need a motion for approval.
So moved.
Thank you, Ed. Second,
Second.
thank you. Discussion, questions? Hearing none. I will do the roll call. Dick Kunert,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sanquist,
Aye.
Mariana Body, aye. Okay, number 7 is the insurance renewal. And this definitely has to be voted on today. So Jason, you wanna?
So the next two items will go hand in hand. So
Okay,
so because we had started our insurance year late last year and it didn't align with the fiscal year, the carrier was not able to get us a quote before we had to submit our budget to the county. Because they don't, I don't know if you're familiar with insurance carriers, but they don't want to give you something too far in advance in case their rate changes, because their rates change so frequently. So anyways, we didn't get this in until after county board approval of the budget and mental health board approval of the budget. We put in for $15,000. There was an increase in the errors and omissions insurance because the increase in funding was going from 8.8 to 15 million, so that increased the overall liability. So the total amount, so we've done two things. One is change the year, so this isn't for a full year. This will actually end now to align with next year's fiscal year, so that we won't have this problem again. Next year, we'll then be able to get the quote in advance of the approval of the fiscal year budget. So we'll know exactly how much the amount is next year to put in the budget. But then the second part is this is going to now come in at $15,743 for errors and omission plus directors and officers insurance, which is $743 above what we had budgeted for this year. So the motion or the item here would be not necessarily to increase the budget, that can be the second item, but to renew the insurance at this rate. Or I guess you could combine it to say, and also then increase the insurance budget for this fiscal year from $15,000 to $15,743.
so we need a motion for approval.
So moved.
Second.
Thank you. Any further discussion, questions at this point? Hearing none, I'll do roll call. Dick Kunert.
Tim has some information, I think.
Tim, I'm sorry, I don't see you on the screen, so.
Okay, so when it was presented to me that we have to submit a budget amendment to the county board, so long as we can just wash it out. So if we take some money from somewhere else to pay for the insurance and the overall budget stays the same, we don't have to submit a budget amendment. But if we need more money if we need to increase the total budget, then we have to submit a budget amendment to the county, and that's all.
So in that case,
I would recommend that we take that out of the community engagement budget. That's $15,000 a year. We were a lot of our community engagement is pretty low cost. And so we were way under budget in that area last year. I think that would likely be the area that we have the most flexibility at this time. That would
Does
Okay.
that have to be another motion, Jason?
That's what I wanted to
Oh.
ask.
I'm sorry, Mary Ann.
No, exactly thinking alike in that regard.
If whoever made the motion amends it to include that the budget would increase in insurance by $743 and decrease in community engagement by $743, that would probably
Yeah, that would cover both.
So moved.
I'll second
Okay.
again.
Yeah, the motion now, Dick, do you know the wording? So that we can
Well,
second that?
The motion would be that we meet the increased insurance cost of $700
43.
by
Yeah.
decreasing our community engagement fund by $700.
Okay, it's more than 700. We'll make sure that the record, what is the exact cost? 700 and,
$743.
$743.
okay. So we have a motion. I need the second to reflect.
Second.
this. And Dr. Gorski, the second, has seconded. Any discussion or questions?
I just
Hearing-
appreciate Tim bringing that up. I think that's a really good point. We should
I-
always look for ways to, so thank you, Tim. That was really a
Yeah.
good
Advice.
good comment. Yeah.
Very helpful. Thank you. Roll call, Dick Cooner,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist, Mary Ann Abadi, aye. Linda? Oh,
Yes.
Okay, aye. All right, very good. So moving down to our discussion items, Q1 outcome report. Jason?
Yeah, so we've included for you a summary of the Q1 outcomes. We've kind of identified what some of the common themes or trends are, and then just give a little bit more of a detailed breakdown for each individual funded program in terms of where they're at. We also give you this kind of global overview of, if we're looking at all of the funded agencies together have 141 agreed upon outcomes that they will report on. It's about an average of 11 outcomes per program. And each of those have a benchmark. They have a target number that they're trying to reach and a target date by when they're trying to meet that goal. Based on that, so again, 141 total, we have 55% of those are either completed or in progress, a total of 77. So while there are some delays, mostly hiring issues, and there are some things that particular outcomes or goals that have not yet started, we really are on track for meeting a lot of these goals that programs proposed. If we're looking at common challenges, the major common challenge right now is workforce, is hiring. I mentioned before, it is a national crisis, it is a statewide crisis, it is a local crisis. It is being dealt with on a statewide level, and also certainly we are looking for solutions and opportunities to address it on a local level, as previously discussed. But in spite of that, we have some really great success stories as well. And a few programs that have been able to meet their hiring demands, Youth Services Network has actually filled all of their positions, which is wonderful. A few other organizations have started hiring or have confirmed hires. The Children's Home and Aid Doula Program, Family Counseling Center, I went and looked at their new expanded space. It is beautiful. They have a dedicated play therapy room and a dedicated art therapy room. It is really nice, warm, and inviting. And they have new therapists that are now filling that expanded space. And they've already seen a decrease in their waiting list due to these new therapists coming on. So that's a system capacity outcome that we've already seen improve. Remedies Renewing Lives, as I've mentioned, not only do they have their therapists for their domestic violence advocacy program, but they've also really spent a lot of time being very thoughtful about how they're going to incorporate and integrate mental health services with their domestic violence services. So I think that's really a really great win there that maybe doesn't get captured in the outcomes. And Crusader has seen some improvements in their Medicaid assisted treatment program, where their retention rates for making sure clients stay in services are 80%, comparing that to a national benchmark of about 20 to 50%. So really great job for their program as well. And Wendy kind of mentioned the wonderful applause for the co-responder program and all the impacts that has made, not just in making first response, but in the way it has done follow-up and advocacy within the court system and filled some of those criminal justice gaps. And they now have 181 individuals that they've served in this first quarter. So great job for them. And I'll just highlight the jail too, even though they don't have any reported outcomes yet. I just got the signed contract from them, I believe yesterday. They have a provider who is going to be starting services in the jail on January 1st, bringing in 4 full-time behavioral health specialists and a advanced psychiatric nurse practitioner. So we're really excited about getting those services started in the jail. And they've been a great partner in communicating with us along the way.
And Jason, can I point out that having that nurse practitioner, what we're hoping, I've been talking to our civil division about getting, so once someone leaves the hospital, if they haven't been, committed involuntarily and they end up in the jail, the problem is we can either release them or they end up in Elgin, which often is not appropriate. With that nurse practitioner, what we're hoping to do is that person becomes the referral source back into the civil system. And what we're hoping for is maybe getting family members appointed as guardians ad litem for medical decisions in the civil court, so we can move people out of the criminal justice system into appropriate treatment venues. But the gap had been the jail, because in the jail, there was nobody who could provide a medical opinion that someone was a danger to themselves or others or unable to care for themselves. So that we're trying in the state's attorney's office to utilize this program to get people moved into better services.
And a question about that, would it also involve a ordered medication so that the client would have to continue?
That's one of the things I'm talking to Sherry Zach, who's our civil attorney, about doing that. The problem is, so we can say, okay, you have to take medication,
Right.
But if there's no provider, who's writing the script, And this is where having that web comes in terms of, you have an indigent person, let's get them hooked up into the Crusader program. We, have beds available, or we have resources available through other providers, so this is where everyone needs to be talking to each other to say, Wendy's got a problem. Let's collaboratively solve it. Jail isn't the answer. We have too many people, fewer, but too many still, who need to be back in the community and can be managed in the community with support. So I think this is all our vision, right?
This is excellent. If this kind of transition could occur,
Right.
With the help of the courts, it would be phenomenal. So,
And Judge Gibbons definitely is very attuned
I know
to
he's
this and
quite an
working.
advocate. I've
Yeah. So,
heard and read.
and the public defender also, because we're selfish. We're looking at this going, hey, one less case I have to deal with. It's sucking time, and we'll move it somewhere more appropriate. So that's the goal.
Okay. Well, thank you for the information. All right. Any other questions about the outcome report?
Yeah, Marianne.
Mary?
Okay, Jay.
I just wanted some clarity from Jason here. In the collaborative effort with the police department and psychologists, are they actually doing first responder type thing, or is it all follow-up?
There is first response involved, okay, but what they are learning, or I should say, the challenge that they're facing is that a number of things. Number one is that they are not available for every first response. And secondly, that even if they were even if we had a team that was big enough to be available for every first response, 911 dispatch sometimes is still going to have a first responder that's not part of their team be first on site, and then would call them, would identify that this is a mental health issue and call them. So to that end, I think one of the things that might be helpful in the future to really create the ecosystem we're looking for is that all of law enforcement be trained in CIT, knowing that it's not just co-responders that will be first on scene.
Right.
Right.
It's great. Okay, Terry. You're on mute.
Sorry, how about now? What was Jason was saying, they're not necessarily called right away. In the co-responder program, it all depends on the situation. If it's the same person who they've had problems with for the last, umpteen years, they pretty much will already know what to do. When that call comes into the cop on the street, suicide situation, whatever, the cop will respond first. And if the co-responders are needed, they'll be called too. Because sometimes it's not always, there's a lot of gray area in that, a lot of gray area. Even when I'm out there, you'll get that call and you go there and it's like, they weren't really suicidal. It's just the way it's being portrayed. So it all depends on the situation. It really is about the situation.
However, our goal is to move them closer to the model as we know is best. And it is
Yep.
the response of both the mental health worker and the police. So, but
A lot of angry people.
Yeah. Mhm.
Just anger is what I see displayed mostly.
Okay. Any other questions or comments on this? All
Yeah,
right.
Marianne, I do.
Okay, Dr. Gorski.
Yeah, and just what Terry and Jason were just talking about, I was really, pleasantly surprised, I guess, to see that 181 individuals served in the co-responder program. But I guess what struck me, and Jason gets back to the conversation we had a week or so ago, I think as we mature and as they mature, first of all, that number will grow. And the true downstream or more longitudinal outcomes of whatever that intervention was should be something that we get better at recognizing and measuring. So yeah, there may have been 181 touch points of the team, but what then actually happened to those individuals as far as, say, mitigating the next problem, whether it would, and as I mentioned to Jason, when Swedes in the city of Rockford started the mobile integrated health model a few years ago with the co-responder of the nurse with the EMS guy person. That was a difficult program, but some of the downstream outcomes were fairly simple. Number of avoidable 911 calls, number of avoidable unnecessary ER visits, number of avoidable admissions. And so those, not only is that bad healthcare, it's monetarily bad. So in the same vein, I think in this, if we keep pushing ourselves to understand, we all agree, I'm sure we all agree, it's not just about the number, but what actually happened with those folks. And did they avoid whatever the next step would have been,
right,
if the intervention hadn't occurred?
Exactly.
I couldn't agree more with you. And that is such a good point to emphasize. And to me, it's almost like we've got to complete the circle, because the officer themselves have to realize the value of what they're doing is improving the life of that individual. And look at, you kept them out of the ER, you kept them, you know, did not have to arrest them, did not have, you know, they didn't penetrate into the criminal justice system any further, all of those. So that feedback is critical because, you know, just going through the motions, yeah, we went out with the mental health worker or whatever, that's, we want to somehow have the officers be able to internalize how essential their part in this whole intervention was and how the quality of life of that person improved because of it. So I agree with, you know, it's such a valuable discussion. And yeah, Ed.
I mean, not on that subject, but just on how this information is presented, I just want to celebrate Jason and his team once again for putting this together in a way that's just so easily digestible and it's just clear and you can grasp it, you know, almost immediately. And just want to reiterate the call that has been made all throughout this meeting that somehow or another we need to broadcast or amplify this information as much as possible so that people can see their dollars at work and could see that, okay, there is a way that you can put something together where you can actually get impact and you can see the impact and you can monitor and evaluate, you know, how the return on investment that you're making. So I just want to commend
5 years to prove to the community the value of these programs. So 5 more years, I should say. But yeah, and Jason is, I think, working around the clock, you know, as we all know. So yeah, really good point, Ed. Okay, any other comments on that matter? If not, we'll move into the last discussion item, and that is the program year 2022 to 23 grant application. So Jason.
Yeah, so we're gonna make some updates to the funding policy in coordination with the legal counsel. I don't think there's a lot of changes needed, but I think we have to update a couple of things based on what we've learned over this past year, just for clarification more than anything. You know, I don't know that it was clearly what we maybe thought was clear to some of the organizations in processing their funding requests, maybe didn't understand that this was an expenditure-based grant and that we were reimbursing them for approved expenses, not necessarily a pay for performance where you know, you just get dollars released every time you hit a certain threshold. So we want to just articulate that more clearly. I mean, there's still let me be clear, there's still performance requirements that are being monitored, but the actual reimbursements that come through are expenditure based. So we'd like to update to reflect that in the funding policy, so that's very clear, and in the funding agreements for that matter. One point that I think maybe requires some board discussion, and we'll put this as an action item on the next month's meeting packet, but we last year, kind of our funding policy actually dictates that to receive any funding from the mental health board, you have to be in existence for 3 years. And then as a board, it was discussed and agreed upon that if you weren't the lead agency, that you didn't necessarily need to meet that criteria. But so we communicated that as an exception to our funding policy to everyone, but it wasn't formalized in the funding policy. So moving forward, I think if we are going to do that, we should just formalize that one way or the other. Are we allowing agencies that are not the lead agency to not meet that same standard of having been in existence for 3 years?
Yeah, that's a discussion.
Well, that goes with the discussion that we've had earlier this afternoon. If we want new innovative kinds of things, or if we want new people, to step up and come up with some novel ideas, yeah, we would agree with that they attend attach themselves to a larger organization. And so they're not going to have they will not have been in existence for 3 years. So let's make the change that allows us to have that phenomenon.
Yep.
Could you talk about, though, we don't want to be in a position where the organization is defrauding us, so what are the financial, all right, money people, what are the words I'm looking for? Some sort of oversight or guarantees or something that ensures that we're not babysitting, but we're allowing for innovation. I mean, we have some fiscal responsibility here too.
So the burden would be on the funded organization, and it already is on the funded organization if they have collaborators on their application to make sure that their subawardees, so to speak, are in compliance with the funding agreement and all of the mental health board's policies. And so we check everything still. They submit to us receipts and expenses, and all their contracted work is also submitted to us. They're required to submit evidence of all of their expenses before they are authorized to receive payment. But in terms of monitoring and managing the actual, subaward, that would be the responsibility of that funded lead organization, who would have to be.
Oh, you're not, okay, then I misunderstood.
Not
You're not talking about
lead organization, only for a collaborating organization.
Right.
Okay, all right.
Right, we're not talking about mission drift.
No.
Whatever is innovative would have to come in for what it is that we've already identified as our mission.
I was thinking you were going to allow just,
No.
Jay and I decide to do a treatment
way.
program.
No.
And it sounds
at
great.
all.
No way.
And then, okay.
Yeah. No.
All right. Okay. Fair enough.
So just for clarity, Jason, as you described process, does that mean that we can stop funding at a point in which we don't feel things are happening the way they were intended to happen?
Yeah, and I don't want to communicate the details of that without having a funding agreement in front of me, because that is a contract we have with each agency, so I don't want to miscommunicate that. But there are some specific things that would indicate non-compliance that would be breach of contract and would stop payment. And of course, we only make commitments for 1 year at a time. Our intent might be to renew programs that's based on them being successful and meeting performance metrics.
Okay.
So no motion required, just wanted to get some feedback and we'll put that on the agenda next time. And then the second thing is, and this is again very just in theme with what we've been talking about, we're just wrestling with this idea of how do we not make it overly laborious for a program to get renewed, while at the same time encouraging innovation and new ideas. So we're proposing a two tracks of applications this time. One that is a renewal track, in which if there's not major changes being made to the program, and we'll define what those are, that you can do a renewal application that will have less questions. So you've kind of already gone through the rigorous threshold in year one. Now you're just saying, we've done all our outcomes, we've met our performance goals, we're renewing this program. There'll be an application for that. And then a second track for new programs. What we wrestled with was, okay, so now what if a current funded program wants to do housing, and at the end of that process, now they've got two different applications, and it's more to manage and it's more paperwork to process. So what we would propose is these two different tracks, and at the end, if we have a lead agency that's doing a renewal program and a new program, that we may give them the option to combine those into one work plan and funding agreement which just makes it less labor intensive on our side for managing it and less labor intensive on their side for producing performance reports and financials on a monthly basis. But the application process would have these 2 tracks to just ensure that it's really fair that that renewal programs don't get to just bake a bunch of new stuff into it, and then they don't have to go through the same rigorous
Right,
process
exactly.
that somebody else does.
That makes sense to me.
Yeah.
Yeah.
That's me too. Okay. Any other discussion? Well, we'll move down to other matters. And the only thing that I was going to bring up at this time is the fact that Dick Kunert and I met with the chairman and one of the board members, Paul Arena, and I did get the opportunity after the meeting to speak with the chairman about our potential board member. And he did say that he was going to make a decision soon. That's all I can tell you. And because we really do need this other board member when, the proposals are let and all the work that is generated from that. So I'm hoping that he is serious about this. So. And then I will need a motion for adjournment and
Tim has got his hand up, Mary Ann.
Tim, you took Dick's spot. Dick, are you?
No, actually, I got a question.
He has a question.
Oh, okay. Tim.
I just wanted to know if Wendy was willing to speak to her meeting with the chairman. I don't know.
Sure.
I had a very nice meeting with the chairman. I thought I would have heard something one way or another. One of the things I said to him was I was the person who had urged Jeanette Towns to also apply, because I think Jeanette is excellent. And I think there's a lot of, I don't know, I think he's got a lot on his plate is my impression. He's got 1,000 little things that had been unattended to for several years. And I think he's just juggling. So that's the impression I was left with. But I told Mary Ann, I think maybe I'm just gonna give him a phone call and ask him what's going on. I feel like I can serve in the capacity I'm in for the, near future, but the board needs a full complement of people.
Mhm.
We do.
And I will tell you, he indicated a great interest in also the county wants to apply for some of the money that's out there. So that will be interesting. They have an interest in addressing some of the issues of children. And I said, I thought that was also a huge board priority, that we were pretty disappointed that we hadn't gotten more applications, but I think it's a resource issue in the community. But we're making progress, so fingers crossed.
Okay. All right.
So,
All right. Any other comments or discussion?
Move for adjournment.
Okay.
Second. I second.
We have a first and second, so I will take roll call. Dick Kunert,
Aye.
Dr. Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist. Aye. Mary Ann Abadi, aye. Okay, thank you all very much. And
Thanks, everybody.
Have a happy Thanksgiving, everybody.
Yeah, I
Yeah.
can't believe we're
Thanksgiving.
saying that, but happy Thanksgiving. Yeah.
happy Thanksgiving. Everyone be
Okay.
safe.